Raloxifene is a selective estrogen receptor modulator that is used to prevent and treat osteoporosis and reduce the risk of invasive breast cancer in high-risk postmenopausal women. In this video, let's found. What is Raloxifene? What is Raloxifene used for? Contraindication. What are the side effects of taking Raloxifene? How does Raloxifene work? How to use Raloxifene? What is Raloxifene? Raloxifene, sold under the brand name Evista among others, is a medication used to prevent and treat osteoporosis in postmenopausal women and those on glucocorticoids. For osteoporosis, it is less preferred than bisphosphonates. It is also used to reduce the risk of breast cancer in those at high risk. Raloxifene was approved for medical use in the United States in 1997. It is available as a generic medication. In 2020, it was the 292nd most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is Raloxifene used for? Indicated for the prevention and treatment of osteoporosis in postmenopausal women, as well as prevention and treatment of corticosteroid-induced bone loss. Indicated for the reduction in the risk of invasive breast cancer in postmenopausal women with osteoporosis or postmenopausal women with a high risk for invasive breast cancer. Contraindication. Raloxifene is contraindicated in lactating women or women who are or who may become pregnant. It also may be of concern to women with active or past history of venous thromboembolic events, including deep vein thrombosis, pulmonary embolism, and retinal vein thrombosis. Side effects. Hot flashes, including sudden sweating and feelings of warmth, especially common during the first 6 months of treatment. Increased white vaginal discharge. Joint or muscle pain. Mental depression. Problems of stomach or intestines, including passing of gas, upset stomach, or vomiting. Swollen joints. Pharmacodynamic. Raloxifene belongs to the selective estrogen receptor modulator, SERM, drug class that exhibits estrogenic effects on bone and lipid metabolism while mediating antiestrogenic effects on uterine endometrium and breast tissues. On skeletal tissues, raloxifene stimulates bone depth osteoblasts and inhibits bone-resorbing osteoclasts to augment bone mineral density. Raloxifene produces estrogen-like effects on bone, reducing the resorption of bone and increasing bone mineral density in postmenopausal women, thus slowing the rate of bone loss. Raloxifene promotes estrogen-like effects on lipid metabolism. Raloxifene is not associated with causing alterations in the serum levels of HDL cholesterol or triglycerides. As the HDL cholesterol level is considered a strong inverse predictor of cardiovascular disease in women, the cardioprotective effects of raloxifene were questioned. Due to data on the long-term trials, it is not possible to determine whether the small lipid effects produced by raloxifene correlate with a smaller degree of cardioprotective activity compared with hormone replacement therapy. Mechanism of action. Raloxifene is a selective estrogen receptor modulator that acts as both an estrogen agonist and antagonist via differential effects on the tissue-specific estrogen receptors. Based on the findings of competitive binding assays, raloxifene displays binding affinity that is similar to that of diol, the predominant circulating estrogen. Ligand binding induces a conformational change in the receptor that promotes dissociation of the receptor from HSP90, dimerization and translocation into the nucleus. This movement into the nucleus allows the receptor to bind to genomic locations based on sequence recognition. The DNA binding domain, also known as the estrogen response elements, EREs. Pharmacodynamic. Raloxifene belongs to the selective estrogen receptor modulator, SERM, drug class that exhibits estrogenic effects on bone and lipid metabolism while mediating antiestrogenic effects on uterine endometrium and breast tissues. On skeletal tissues, raloxifene stimulates bone depth osteoblasts and inhibits bone-resorbing osteoclasts to augment bone mineral density. Raloxifene produces estrogen-like effects on bone, reducing the resorption of bone and increasing bone mineral density in postmenopausal women, thus slowing the rate of bone loss. Raloxifene promotes estrogen-like effects on lipid metabolism. Raloxifene is not associated with causing alterations in the serum levels of HDL cholesterol or triglycerides. As the HDL cholesterol level is considered a strong inverse predictor of cardiovascular disease in women, the cardioprotective effects of raloxifene were questioned. Due to data on the long-term trials, it is not possible to determine whether the small lipid effects produced by raloxifene correlate with a smaller degree of cardioprotective activity compared with hormone replacement therapy. Dose: osteoporosis in postmenopausal women. 60 mg POQ. Breast cancer. Prevention, risk reduction of invasive breast cancer in postmenopausal women at high risk for invasive breast cancer. 60 mg POQ for 5 years. Safety advice. Pregnancy and breastfeeding implications. Raloxifene is a U.S. FDA pregnancy Category X medicine. Pregnancy and lactation constitute a contraindication to using raloxifene. Fertile women wishing to become pregnant need to avoid or discontinue this drug. That's all the information about raloxifene we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.